Chanelle, I'll be your massage therapist today. So you can come and sit on the table if you'd like. So, can you tell me a little bit of the reason why you're here today?
I've been having headaches for like the past couple of days.
Okay. Is there anything that you can't do because of your headaches?
Not really. It still bothers me, but I still do what I've been doing.
Is there any areas that you'd like me to focus on today?
Yeah, I guess kind of like my neck is really bugging me.
Okay. So we're just going to go through your health history form. So you have no cardiovascular problems, no respiratory. Let me know if anything has changed at all.
Yeah.
Any infections?
Nope.
Any other conditions? No. Well, I guess you have a history of headaches. You're not pregnant. No. You're not postmenopausal.
No.
You're not on any current medications.
Nope.
No. Are you currently receiving treatment from another healthcare professional? Have you had any surgeries recently? Do you have any other medical conditions that I should know about? Any internal pins or anything?
No.
No. So do I have your consent to assess you and go through this setting? So you're a receptionist. So could you just tell me a little bit about how you sit at your desk and or what sitting position you're in?
I kind of say I'm sitting now, but like my computer's a laptop, so I'm
So
like
do you
really like
slouch over
looking
at
like
all?
down. Look down at it. I guess my shoulders like
Yeah.
slouch a bit. Yeah.
Okay, what kind of chair do you sit in? Do you have like a back supporter? Or
Yeah,
anything?
I do. I don't use it much. I'm mostly sitting like up on like just like without the back support, but I do have a comfortable chair. Yeah.
Okay. Have you had any previous trauma
No.
before this? Okay. Do you get rashes or stiff neck, or is it hot at any point in time? No. Okay, so that's just I'm just testing for meningeal problems, so you're fine with that. Do you have a headache right now?
I did earlier today, but it's gone now. So.
Okay, good. Do they occur often? Would you say?
Yeah, maybe like twice or 3 times in a day, and usually like after I've been working for a couple hours.
Does it disturb you when you're sleeping?
No.
No. Just because of that, I just want to know, like, do you grind your teeth at all? No. Just because in a case study done by Rosella, DeLuca, Canto, and many others, they have found that tension headaches and migraines affect sleep rhythm, also known as teeth grinding. So that's just why I was wondering about that. What position do you sleep in?
On my back.
Okay. How many pillows would you use?
Usually 2.
2 behind your neck?
Yeah.
Okay.
With my head up.
Okay. Are you sensitive to light, aroma, sound at all?
No.
No? Okay. Have you sought out any medical attention?
No.
Is this the worst headache you've ever had?
No.
No? Okay. Okay, so we're just going to go through a couple pain questions that I have for you just to kind of close in on what I think the problem is today.
Okay.
So could you tell me the location of your pain? Or show me wherever you
It's kind of like behind my neck and like here-ish.
Okay, so just around your ears,
Yeah,
close
kind of
across
like
your forehead.
around
Okay.
back of my head too.
How long does it usually last?
Well, it goes on for like a couple of days.
Couple of days? When would you say it started?
A couple of days ago,
Yeah.
maybe like 3-4 days ago.
What would you rate it out of 1 to 10?
I'd say about like a 6.
6. So it's aggravating, but it's not
Yeah.
completely unbearable. Okay. What does it feel like to you?
It's kind of like dull, and it feels like I don't know, like pressured.
Okay, so just pressure everywhere.
Yeah.
Kind of. Would you say it's kind of like you're having a sweatband around your head?
Yeah.
Okay.
Yeah, that's a good way to
Okay.
describe it.
Is there anything that makes you feel better?
Usually when I like rest or like take a nap or something, or like sometimes I put like a hot pack on the back of my neck, and that helps it too.
Okay, good. Anything that makes you feel worse? Would you say?
Yeah, usually when I'm like stressed, or if I haven't like slept, like I'm tired, or if I'm like cold or something. Makes it
Any
worse.
medication that you're taking because of it?
No, I'm not taking meds.
No Tylenol, Advil. No. Okay. How frequent would you say the headaches are occurring?
I don't know, maybe like sometimes it's like 1 time a day or 2 to 3 times a day.
So it just changes
Yeah.
daily. Would you say it refers anywhere?
Yeah, kind of like from like the back of my neck, like instead.
So it just refers kind of in here.
Yeah.
So you'd say like the problem area is maybe down your shoulders, up to your neck, and then around the head.
Yeah.
Okay, great.
So before we get started with your treatment, I'm going to be assessing a couple of things such as the way you walk, your posture, and we will be doing some range of motion, palpation, and special tests. So the purpose of this is just to see if I could get a better clinical impression, and you had no contraindications on your health history, so we are okay to proceed. The complications could be that you might feel some tenderness if we're doing some palpations or range of motion. So if you are feeling any discomfort, let me know, and at any point in time we can stop. It is totally up to you when you feel your discomfort. If I notice anything outside of my scope of practice, then I will refer you to another healthcare practitioner. Do you have any questions? No? Are we okay to proceed to? I have your consent?
Yeah.
Before we start, is it okay if I take your blood pressure?
Yeah.
Okay, so first I'm just going to find your brachial artery, and then I am going to place the cuff around your arm, and I'm going to increase the pressure of the cuff. If at any point it becomes too uncomfortable, you let me know and I'll decrease the pressure right away. So now I'm just going to find your radial pulse and increase the pressure of the cuff until I can no longer feel it. Okay, good. So I'm going to increase the pressure one more time, and I will be listening for your Alright, so your blood pressure is a little bit low. It was 112/73. So is low blood pressure a normal thing for you?
Yeah.
Okay. Okay, so what I'm going to have you do now is just walk forward and back a couple of times so I can analyze your body positioning when you walk. So whenever you're ready, just walk forward. Good. So I noticed that there's a slight lack of arm swing when you walk, and your upper body seems quite stiff. There's not much movement going on in your neck and shoulder area. Your feet look quite good. They're pretty straight, and there's a good movement in your hips. Do you mind if I just place my hands on you to see some alignments?
It's okay.
Right. So starting with your feet, I noticed that you do have flat feet. Your lateral malleoli are fairly in line, and as well as your medial malleoli. Moving on to your knees. The level of your knees is also in line. Your head of your fibula looks to be in line as well. Do you mind if I just put my hands on your hips? Okay. So your iliac crest is also in line, and your ASIS also in line. Moving on to your arms, they do look to be slightly internally rotated. So I would say that that is excessive supination. No, sorry, pronation. Your shoulders. Your left shoulder looks to be a little bit lower. Are you left-handed?
Mm-hmm.
Yeah? Okay, so that would explain it. Your right shoulder, your upper traps do seem to be a little bit elevated. Your jawline looks good. Your head looks to be slightly tilted to the right. Your acromion, your external auditory meatus, your greater trochanter, head of the fibula, and lateral malleolus all look to be in line, which is excellent. Once again, your shoulders seem to be slightly internally rotated. There is no protraction of the head or neck or jaw. So everything looks good. If I could just have you turn to the other side. Perfect. Once again, everything seems to be in line with each other. And also, the internal rotation of the shoulders is bilateral. And if I can have you facing the back. Excellent. I'm going to start with your feet once again. So do you mind if I just lift up your pants a little bit?
Yeah.
Thank you. So I do notice that there is a little bit of Helbing sign with your Achilles tendon. Your knee lines look to be in line, everything's straight. Your iliac crest is also in line. Your PSIS are also very in line. Moving up to your shoulders, once again, that left shoulder is slightly depressed, which is normal because you're left-handed, and the right shoulder is elevated. And from here you can also see that slight head tilt to the right.
Alright, so I'm just going to palpate for your suboccipitals and as well as your upper traps. So you let me know if it's tender at any point in time, okay? So I do feel that they are quite tender for your suboccipitals. How does
Yeah.
that feel?
That's sore.
Yeah?
Mhm.
Does it refer anywhere?
I kind of feel it all along in here.
Okay. So there's no heat, which is a good sign that there's no inflammation. Texture feels normal. Tone, I'd say they're slightly hypertonic, and I noted the tenderness as well. Okay, good. So moving on to your upper traps, you let me know how that feels, okay? How's that?
Sore too.
So
Yeah.
slightly tender as well.
Yeah, it's kind of tender.
Yeah, they do feel a little bit hypertonic as well. Once again, no heat, so no inflammation. And texture also feels normal.
So we're just going to do some range of motion, and then we're going to do some assessment and special tests. So we're going to start with ruling out the joint above and below. So because your pain is mostly in your neck, we're going to rule out your jaw and your shoulder.
Okay.
So if I could just get you to open your mouth. Any pain with that or anything?
No.
Any discomfort? Okay, and then can I get you to kind of move your jaw side to side and deviate it? Any pain with that at all? No. Huh? Alright, so if I could just get you to bring your one shoulder above to your ear. Any pain or discomfort with that?
No.
Alright, and then the other one? Any pain or discomfort?
No.
Alright, and then we'll bring your other arm back up to your ear, out sideways. Any pain or discomfort?
No.
Lovely. And then the other arm again. Any pain or discomfort?
No.
Lovely. We're just going to do active range of motion of your neck.
Okay.
So I'm just going to tell you the direction that I want you to move, and then you're going to do it all on your own.
Okay.
So I'm going to start with getting you to bring your ear to your shoulder. Awesome. Any pain or discomfort with that?
No.
Alright, and the other side? Again, any pain or discomfort?
No.
No? Alright, and chin to your shoulder? Any pain or discomfort?
No.
Awesome. And the other way? Lovely. And then I'm going to get you to extend your neck back. Any pain or discomfort with that?
No.
No. And then your chin to your chest. And any pain or discomfort with that?
And I feel a stretch like in the back of my neck.
In the back of your neck?
Yeah.
Just as you flex there?
Yeah.
Okay. Alright, so I'm just going to do some passive range of motion, so I'm going to do it for you. And just let me know if anything is painful or uncomfortable.
Okay.
Like that?
Mhm.
Awesome. Is that okay?
Yep.
Awesome. Wonderful. And rotate. Lovely. And extend. Awesome. Is that okay there, or is that painful too?
No, I don't feel anything with that
Don't
one.
feel anything?
No.
Okay. Awesome. Alright, so now we're going to do resisted. So we're going to put you in mid-range, and then we're going to build for 5 and hold for 5. Okay? 2, 5, hold, 2, 3, 4, 5. Is that alright?
Mhm.
Awesome. And the other side. 2, 3, 4, 5. Hold, 2, 3, 4, 5. Any pain or discomfort with that?
No.
And then we'll do extension and build it for 2, 3, 4, 5. And hold 2, 3, 4, 5. And then we'll do rotation. Build 2, 3, 4, 5. Hold 2, 3, 4, 5. Awesome. And then the other way. Build for 5, 4, 3, 2, 1. And hold for 5, 4, 3, 2, 1. Any pain or discomfort with that?
No.
Alright, and then we'll do flexion. 2, 3, 4, 5. Hold 2, 3, 4, 5. Any pain or discomfort with that one?
A little iffy, but not bad.
Not bad? Okay. So all of those would have been a grade 5. So before, we're just going to test out or rule out any neurological issues. So before when we did neck flexion, that was a myotome for C1 and C2. So now I'm just going to rule out a dermatome, so just to make sure that you have no neurological issues at all.
Okay.
Right?
Yeah.
So I'm just going to run my hands here, and I just want you to let me know if you feel anything different. And I'm going to have you close your eyes while I do that.
Okay.
How does that feel?
I felt the same.
The same?
Yeah.
Nothing, no tingly, no anything? Okay, so we're just going to move on to the special test portion. And I know we kind of already did our consent and let you know what's going on, but I just kind of want to reiterate what's happening and make sure that you're okay with it.
Okay.
So these tests may recreate some symptoms that you have and they may be uncomfortable. Definitely let me know whenever that happens so that we can stop and take action from there.
Okay.
So the test that we're going to do is we're going to do compression and distraction, which is just pressing downwardly on your head, and then we'll be pulling up after. And then next we're going to do spurlings. So it's quite similar. We're again going to do the compression on your head, and then we're going to do extension and then compression again, and then we're going to do lateral rotation or lateral flexion and rotation again, and press again. And if you feel any tinglies or anything in your arms or any kind of pain at all, please let me know. And then we're going to do limits, which is having your legs straight and your hips flexed, probably on the table. And then we're going to flex your neck, and you're going to let me know if you feel anything at all again.
Okay.
All right, so we're just going to start with compression. Let me know if you feel anything.
Okay.
How does that feel?
Feels good.
Feels okay? Yeah. All right, and then we're going to do distraction. Does that feel okay?
Yeah, feels fine.
Awesome. So that would be a negative. If it were positive, you would have felt a recreation of your symptoms, and it tests for neurological issues.
Okay.
Radiculopathy. All right, so we're going to move on to spurlings. So we're again going to do the compression.
Okay.
Is that okay?
Yep.
All right, and then we're going to move into extension, and we're going to apply compression again. Is that okay still too?
Yeah.
All right, then we're going to do flexion and rotation, and we're going to compress again. Any pain or anything like that?
No.
Okay, so that would be negative, and if it were positive, you would have felt some pain radiating into your arms.
Okay.
On this side, and that would have tested for like a disc herniation or something like that.
Okay.
Okay, so our final test is going to be limits. So I'm going to have you seated like this, and then I'm going to flex your neck passively, so I'm going to do it. And then you let me know if you feel any symptoms into your back or anything like that.
Okay.
All right. How does that feel?
Feels fine.
Feels fine?
Mhm.
Okay, so that would be negative. If you had been positive, that it tests for a space-occupying lesion or a cervical spine myelopathy. For our last part of our assessment, I just want to know if there's any other motions that may cause you pain. Like, is there anything outside of the things that we've done today, like at work or anything that recreate any of your pain?
Sometimes when people come in, like if they ask me questions, I like sometimes like nod at them and like it kind of like feels uncomfortable back here. Same with
Okay.
when I like shake my head no, kind of like
Okay.
yeah.
Is it big shaking your head no and big shaking your head yes, or is
No,
it
it's like I'm not. It's like kind of like that.
like that and
Yeah.
little
Yeah, it's like
nods
little
too?
nods. Yeah.
Okay.
I feel like a weird if I do big ones. So
Okay. So based on kind of what we've done today, my clinical impression so far is that there may be a trigger point in your suboccipital muscles, which are the muscles right at the base of your skull, and maybe some like fascial adhesions in your upper traps because they're pretty tight there.
So for the treatment today, I'm going to be having you between the sheets here with some pillows and such, and I'm only going to be undraping the areas that I'm going to be working on. So first I'm going to start with you face down. We're going to work on your back as well as a little bit on your upper neck as well. And then from there, we're just going to turn you over, and then I'm going to be working a little bit like on your front side of your neck where some of your muscles are here, as well as a little bit more on your upper traps since they did feel a little tight when I was palpating them. The benefits today are that I'm hoping that I'm going to reduce some of the trigger points right in the back of your head there that I suspect might be there, as well as if there are fascial adhesions, I hope to get rid of them for you completely. From your health history, I see no contraindications, so that's really good. So it means we can continue on without any modifications. The risks though are that after, since you will be face down, you might feel a little bit dizzy sometimes getting off the table, but that's completely normal. If I see anything that's out of my scope of practice, I can refer you to another massage therapist, or if you just didn't like my treatment, I can refer you out as well. And so the consequences of not getting today's massage are that you might continue to always feel that kind of pain, or not really pain, but achiness in the back of your neck. Throughout this treatment though, you're completely in control. Let me know anytime if you want more pressure, less pressure, if you feel uncomfortable, and we can try to modify that for you so that you do feel comfortable, okay? It's really important that you also communicate with me that as well, because it's all about you today, that we want to try to reduce all that for you. Do you have any questions for today?
No, I'm okay. So
Awesome. Do I have your consent to treat?
yeah.
I would like to talk to you about my goals for you for today.
Mhm.
So So today while you're on the table, when I'm treating you, I'm hoping to get rid of some of the hypertonicity that is in your upper traps. So all that means I'm just hoping to get rid of the tightness for you by using things like effleurage, petrissage, which is just kind of a technique just to move fluid and stuff like that, just to release some of that area there. As well as, you said it was about 6 out of 10 back here for you?
Yeah.
I hope to reduce that to about a 4 or 5 out of 10, just for, since today is a little bit shorter of a treatment. I hope to just lower it a little bit for you. Maybe not fully get rid of it, but hopefully next treatment we can definitely reduce that even further. I also want to reduce any fascial adhesions you have as well. Alright, so I'm going to start by draping your back first, alright?
Okay.
Is it alright if I tuck into your undergarments?
Yeah, sure.
And how's the pillow feel?
It's comfortable.
Sorry, my fingers may be a bit cold.
Okay.
But I'm going to start treatment now, okay? How's the pressure feel?
It's good.
It's good? Do you still feel comfortable? Great. Right, I do notice on your upper traps, which are just some muscles that just lay right here, that they're a little bit tight, like on the skin level. So what I'm just going to quickly do is just wipe off some of the lotion, and then I'm going to do a technique called skin rolling on them. So it's going to be a little bit painful in a way that it's going to kind of feel like burning.
Okay.
But just let me know if it becomes too much, alright?
Okay.
So I'm just going to quickly just take some of the lotion off. Just easier to do without the lotion. Alright, before I do that, I'm just going to quickly assess the fascia more in depth, okay? Just let me know. Alright. Alright, so with the assessment, I notice that your skin going out towards your shoulder blades is a little bit more tight. So that's what I'm going to be working on, alright?
Okay.
So I'm just going to be picking up your skin, okay? Just let me know if it comes too much. Actually, a little bit more lotion off. Does it feel okay? It's not too much?
No, it's okay.
It's okay? It's a little hard to grab. My hands are still full of lotion, but that's okay. There we go. Much better. that still feel alright?
Mhm.
Great, I'm just gonna move to the other side. I'm just going to kind of flush out the area a little, okay? And then we're going to be turning you over very shortly since we have a little bit of a shorter treatment today. So it didn't hurt too much?
No, that's okay.
And is the pressure okay right now?
Mhm.
Wonderful. Alright, so I'm just going to be redraping your back, alright?
Mhm.
We're going to be turning you over very shortly. Just have to redrape you first. Alright, so if you could for me kind of do a plank / push-up just so I can pull the abdominal pillow out. Wonderful, thank you. Alright, what you're going to do is just shimmy downward so that your head won't be on the headrest anymore. And just a little further. Wonderful. Alright, so I'm just going to support the sheets and I want you to turn toward me. You still feel comfortable?
Mhm.
I'm just going to have you reach over to your other shoulder. Okay, and then back down. And reach over to your other shoulder. And then back down. Wonderful. Alright, so I'm just going to be working on your upper traps as well as your occipitals, alright?
Mhm.
Feel alright?
It's a little sore.
I'm sorry? It does
Yeah.
feel very tight right here.
Mhm.
I actually feel kind of a top band just on your one side here. When I press down on it, do you feel anything?
Yeah, I feel it all up in my head over here.
Okay. Is it tender at all?
Mhm.
Alright. So that means that there's a trigger point there, which just means that your band's a little tight there. So all I'm going to do is just strip along that just a little bit. Is that alright?
Mhm.
Might be a little tender.
It is.
Alright, now I'm just going to put some pressure onto it, alright?
Mhm.
So it's going to be about 20 seconds. I'm going to hold it there, alright?
Okay.
Just slowly breathe in and out when I do that. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Alright. Does it feel alright?
Mhm.
Did you feel a little bit of anything when I stopped putting pressure on it?
Yeah, it wasn't as strong the pain when you were done.
That's good.
Didn't feel it as much up here.
That's a good start to our treatment. Alright. If I had a heat pack here, I'd also put some heat on it as well. Just since our treatment's a little short, I'll get you one afterward. Okay? I'm just gonna quickly work a little bit on your neck. And actually, I kind of feel the same taut band as well on both sides. This one's a little bit stronger than the other. Do you feel anything when I push down?
Yeah, I feel that behind my eyes.
Right there as well?
Yeah.
Alright, so I'm gonna do the exact same thing, okay? I'm just gonna strip on it a little. Right, and I'm just gonna push on it, okay? Again, just we're gonna hold it for 15 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. There you go. Just gonna flush out the area a little bit better, okay? How do you feel now?
Good.
Good? That's good. Okay, I'm just going to flush out the area, and then that will be the end of our treatment. I just want to make sure we get all the fluid out of the area. Alright, so that does conclude our treatment for today. So just get off the table slowly since you did have a massage. We don't want you getting dizzy or anything, so just take your time. As well as you can just redress for that we can talk about your treatment plan for today, alright? Alright, so before you leave, I also would like to create a treatment plan for you because I would like to continue treating your tension headaches as well. So I would like to see you once a week for about 6 weeks, so maybe January 20th in the new year, we could get back together and just do all the reassessments again and see how your tension headaches are doing, see how the range of motion is in your head.
After seeing you once a week from now until then.
Yes. If that's alright with your schedule.
Yeah,
we can
absolutely.
definitely change that later.
No, that works for me.
Alright, overall though, I hope to, by then, to have reduced trigger point pain for you that was like in your back of your head as well as your neck to about a 2 out of 10. If more, wonderful, but I'm aiming for a 2. As well as to reduce any fascial lesions you have to a point where they probably won't live bug you anymore. That's what my goal is really for you. Do you have any questions about the treatment plan or anything?
No, that sounds really good.
Sounds good?
Yeah. I like that.
Alright, so now I'd like to also talk to you about home care.
Okay.
So, when you're sleeping at night, you said you use 2 pillows, correct?
Yeah, behind me.
Alright. Try only 1.
Okay.
Because sometimes when you have 2, you kind of push your head a little bit more forward or to the side, depending on if you're sleeping on your back or on your side. So because of that, it might constrain your muscles a little bit more, which is probably why in the one muscle in the front here you do have one.
Okay.
So just try 1 pillow, see how that works. As well as anytime it does feel achy or bothering you, try going for a hot shower, because you did say heat kind of helps you a little
Yeah.
bit, doesn't it?
Yeah.
So I would try either putting like a hot pack on your neck, or just taking a nice hot shower, nice hot bath, and putting it on back and really help release
How
some
long
of
do
the
I leave the hot pack on?
I'd say at most 5-10 minutes. If it starts to feel achy though, take it off right away, alright? Because I don't
Okay.
want anything getting worse off, so don't put it on for too long.
Okay.
5-10 minutes at most.
Okay.
Also, with at work, your laptop, try setting it up on a more higher scale. So maybe put like, if you have like a stack of textbooks or a stack of really large chunky books at home, going
Okay.
into work and kind of stack them higher up for that. Instead of looking down, you're looking more straight.
Okay. Yeah.
Because then there you're not bending your neck as much, as well as your shoulders might not roll as forward as much. You might be
Okay.
able to.
Yeah, absolutely. I can do that.
So just try that out, and then when you come back next week, we can talk about how you've been doing with like 1 pillow and all that other stuff, and from there we can create a better plan if you really wanted it. That's the plan I would like to create for you.
Okay, sure.
So you have your consent for the treatment plan?
Yeah, absolutely.
Wonderful. With regards to trigger points as well, I know it's a little bit confusing when I talk about it, but there's actually an article by a guy named Maraska, and he's from nursing college in Denver, Colorado,
Okay.
and actually it explains how massage really well helps with trigger points over periods of time, and that's why again I want to see you over a little bit more of a time gap, because over time it will help reduce those for you.
Okay.
So I can give you the link to that, or I can print it out for you.
Yeah, that would be awesome. I'd love to
Awesome.
read
You
it.
can take it home and just check it out.
Perfect. Thanks so
Cool.
much.